I'd like to provide you with an overview of the LP5 course segment. As is the norm, I'll consider the assignments first and then conclude with some general comments on some of the course segment topics which will be considered in this unit of the course. With respect to assignments, again, discussion questions and participation replies need to be substantive. Initial replies are due at the end of the first week of the LP5 course segment, and all participation replies need to be in place at the end of the second week of the course segment. Please refer to the course expectations document with regard to the exact due dates for this particular iteration of the course. Concerning the LP5 assignment, again, there's no page requirement for this particular assignment. It will depend on the initiative and the country selected. Plan length can vary. So the focus of the assignment is to create a plan for a global health initiative of your choice in the country of your choice, other than the United States and Canada, and to apply what you've learned in the class. My suggestion from a format standpoint is to break the plan into various sections. Don't necessarily have free-flowing text. This will help focus your thinking, define your thought flow, and also make it much easier for the reviewer to evaluate the content of your work. Within the overall plan, you should consider the population that's served, the needs of that population as it relates to health, how you go about trying to obtain needed resources to execute the plan, how would you advertise or market the initiative, that is the role of marketing and advertising for this particular plan, how you plan to overcome environmental, social, physical, and cultural barriers that might be encountered with respect to implementation or even conceptualization of the plan itself. Fifthly, how you would assess the success or failure of the initiative, that is, evaluate the plan, and what data you would collect along these lines. And lastly, how you'd apply the lessons learned in the project for future initiatives in the healthcare workplace. The due date for the assignment is the last day of the LP5 course segment. If you have any questions, please let me know. Again, the focus here is not so much on length, but content. There's no page limit required, but the important point is to be very focused in your communication. Don't look at length as basically something that can be utilized in place of quality and clear focus. So those are my general suggestions with respect to the assignment. If you have any specific questions, please let me know. With regard to the topics, the core key competency in this particular course segment is to apply strategies to identify and apply current best practices in the healthcare industry role. Factors to consider when examining health at a global level, and lastly, challenges in global health in the future. I'm going to start out by just making a series of comments and remarks concerning the global environment overall in the healthcare marketplace. I think it's important to note that there are a variety of ongoing trends in the global environment and the global marketplace which will continue to drive efforts and initiatives that will contribute to the resultant evolution of a globalization of healthcare. It's important to secure an understanding of the drivers and forces that are involved that help generate an understanding of how and why certain trends operate and affect the globalization of healthcare, either from the standpoint of facilitating or impeding that particular globalization effort. When you look at the overall global marketplace, there are a variety of diverse areas that have contributed to the dissolution of national boundaries. In addition, there have also been numerous economic drivers that have resulted in economic advantages for corporations to evolve a global presence as well as operate in a global manner so as to optimize their internal operations and also generate as much operating profit and efficiency of operation as possible through evolving a global presence and operating in a global marketplace. So multinational corporations, as a consequence of free trade agreements, the lessening importance of national boundaries, and also the rapid development of information technology, have resulted in many corporations no longer being characterized by a single country of origin. In contrast, the multinational and global identity of both the corporation, as well as in some instances global branding of products themselves, have really resulted in the evolution of truly global organizations and corporations. Examples of companies which could be classified or at least categorized as, in this category include pharmaceutical companies like Novartis or GlaxoSmithKline, healthcare technology companies like Medtronic, healthcare management and consulting companies like McKinsey, and even some healthcare providers as well. I think this is also underscored by the international branding that's been utilized by the JCI and as well as the JCAHO as well. So one of the consequences of globalization is really a greater degree of uniformity of product and service, since from an organizational standpoint, there are fiscal, organizational, and operational benefits to commonalization of products and services which are provided in a global marketplace whenever that's feasible. So this trend results in many products and services which can have minimal differences regardless of the nation or individual healthcare system which is involved with its use or delivery. As numerous countries continue to open their borders to Western trade, and I think certainly the Soviet Union and China are two prime examples of this, this trend will undoubtedly continue in the decades ahead. In addition to economic drivers which have influenced organizations to evolve a global presence and operate in a global manner, there are also numerous global issues which have influenced how countries view and deal with a variety of different health-related situations and challenges. Some of these challenges and issues include the evolution of unique disease states which have the capability of affecting global populations, partly as a direct consequence of global travel, and the gradual dissolving of national boundaries. Excellent examples of this include conditions like AIDS, certainly the current Ebola issue which is currently in place, and the pending threat which is always ongoing of influenza pandemic. These conditions are resulting in increase in research efforts. In addition, also require nations to work more closely together from epidemiologic, diagnosis, treatment, and healthcare standpoints. Since many of these diseases occur in the world's poorer countries, but can spread rapidly to wealthier nations, and the efforts to control or eliminate diseases must truly be global. So while a great deal of the research conducted either presently or in the future will most likely occur in the wealthier countries, health services will nevertheless need to be provided in the poorer countries. So since new treatments tend to be expensive, how this will occur may require new systems of financing and or healthcare delivery. Any solutions which are considered will clearly need to be multifaceted, addressing the political, economic, humanitarian considerations which have relevance to the healthcare issues at hand. An additional challenge, I think, in modern times relates to the effects and threat of terrorism. The increased threat of nuclear, biological, and chemical terrorism will require national healthcare systems to expend scarce resources to really prepare for possible terrorist events as well. This level of collaboration during the preparation phase may facilitate collaboration and a sharing in the efforts involved with the initiative. In addition, it can also encourage collaboration among various nations which should be utilizing response systems to become more familiar with one another's methodologic responses, since there can be some benefit which derives from utilization of similar responses to a common threat. On the other hand, the threat might really lessen the efforts of some nations to expand access, quality, and or research within that country as a consequence of its access to shared resources. An additional factor which is influencing healthcare at both local and global levels relates to the increased knowledge base of healthcare in both clinical, administrative, and administrative contexts. There are a variety of factors that have contributed to this situation. And these can certainly be considered beneficial in the context of having more informed consumers and providers. Firstly, there are many more individuals with some form of advanced education, and as a result, more individuals are entering the healthcare field as employees. There's still a shortage, admittedly, but this is certainly an upside benefit. Another factor that's contributed to this improved knowledge base amongst both patients and healthcare providers is the commonplace utilization of the internet and enhanced information access, which this technology has provided for populations. In many instances, this technology also facilitates the interaction of healthcare workers located in numerous different countries worldwide from the standpoint of communication, and also the synergistic effects which this type of communication has on research initiatives. Of additional note, As researchers and healthcare providers work in an increasingly global environment, there are additional opportunities for interaction with other workers located in other countries to exchange ideas and collaborate as a consequence of technology, as well as increased attendance at professional meetings as well, all of which collectively facilitate information exchange, best practice exchange, and general collaboration. Collectively, all of these efforts and initiatives really aid in the process of having healthcare systems evolve and collaborate more closely with one another, thereby lessening the primary role of some nations like the United States and Western Europe. It should be noted, though, that in a global environment where communication is enhanced as a consequence of technology, and organizations are really evolving to become more goal-focused in their operational mindset, there are numerous opportunities to evolve a more communalized approach to healthcare research and care provision in the decades ahead. And all of that should help facilitate both collaboration, resource access, and hopefully improve outcomes as we move forward into the future. A couple of final topics I want to consider with you here relate to the items that are listed on this particular slide. As I mentioned already, the utilization of the internet has certainly changed the access to information, and use of telemedicine in many respects has also changed both the ability of healthcare practitioners and specialists to provide diagnoses in distal or rural areas of the country. In addition, there's also the use of technology to facilitate monitoring of patients, sometimes distally in intensive care units. And this has already been prototyped in a variety of different institutions in the United States. An additional element here concerns personalization of medicine and utilizing genotyping to basically facilitate the tailoring of pharmacotherapeutic interventions to certain types of diseases. I think a great example here is Herceptin with respect to breast cancer, and understanding the presence or absence of particular tumor markers, which will be able to determine whether or not certain types of therapeutic modalities will work optimally in those particular patients. In the past, drugs were developed for a one-size-fits-all type of approach, but in many respects, not all drugs work optimally in all patients. So as we move forward in evolving and applying on a more routine basis personalized medicine utilizing genotyping, this particular type of technological intervention may facilitate optimization of pharmacotherapy in patients moving forward into the future. There are also disparities in the health status of populations in developed and developing countries. So the question is, what will transpire in the future? Health disparities really refer to population-specific differences in the presence of disease, health outcomes, quality of health care, and access to health care services that can exist across racial and ethnic groups. Disparities represent a lack of efficiency within the healthcare system and therefore account for a good number of unnecessary costs. There was a study conducted in 2009 by the Joint Center for Political and Economic Studies focusing on eliminating health disparities for minorities. And this would have reduced direct medical care expenditures by $229 billion between 2003 and 2006. There are lots of factors that contribute to racial, ethnic, and socioeconomic health disparities. And these include inadequate access to care, poor quality of care, community aspects such as poverty and violence, as well as personal behavior. Certainly the ACA is tempted to provide mitigation of the issue of health access to health care, but these factors are often associated with underserved racial and ethnic minority groups, individuals who have experienced economic obstacles, those with disabilities, and individuals living within medically underserved communities. So consequently, individuals living in both urban and rural areas can experience a variety of different types of health disparities. When you look at the global environment, people in poor countries tend to have less access to health services than those in better off countries. And within countries, the poor have less access to health services in general. So that's an important point to consider. And the challenges remain to find ways to ensure that vulnerable populations have a say in how strategies are developed, implemented, and accounted for in ways that can really demonstrate improvements in access to health care moving forward. Evidence-based medicine has also been an important area of focus. And this is basically something that, in many respects, is transforming how treatment paradigms are utilized and defined in the first place. The bottom line is, in the past, there was a lot of individual approaches to how diseases were treated and diagnosed. As a consequence, though, of evidence-based medicine, and the utilization of it in terms of definition of treatment paradigms, there's a much more common approach in medicine with respect to diagnostic workups within organizations, so that when you see different practitioners, their approach to utilizing treatment paradigms or diagnostic workup paradigms is very much commonalized. And this is because there's a lot of evidence to support certain approaches being utilized. And those are the approaches that are utilized certainly within managed care organizations, and oftentimes within healthcare organizations as well. So this has done a lot to basically evolve best practices within medical establishments, and also has a significant potential impact on global healthcare as well, since evidence is really the driver for the definition and evolution of treatment paradigms in the overall healthcare marketplace. Six Sigma is basically an approach that's been used to foster best practices globally in healthcare organizations. And this basically is also reflective of the fact that quality is an important area of focus in healthcare. Six Sigma has been utilized in the manufacturing industry for quite some time. However, it's recently making its way into healthcare organizations as well. And the point I want to leave you with here essentially is that quality and evidence-based medicine are two key areas of focus in healthcare. And these two areas will probably do a lot to transform how medicine is practiced and how care is administered. And there will always be an ongoing driver to basically close the gap in order to optimize the quality of care, in order to optimize outcomes. And that's intended for two particular reasons. One is there's a clear benefit to the patient, but the other aspect is if you can optimize care and outcomes, you also do a fair amount to contribute to mitigating the issue of healthcare utilization rates and decreasing them. And that overall factors into cost reduction as an overarching theme as well. So I think quality, evidence, and focus on cost reduction in healthcare are certainly areas of focus both within the United States and also globally as well. So I appreciate your attention. Please let me know if you have any questions as we move forward with evolving content for this final assignment in the course. Thank you again.